Dr. Mo, why would you recommend Tadalafil for me? I don't have erectile dysfunction. Everything's A-okay in the bedroom. That's a response I often get from my patients when I start bringing up Tadalafil, aka Cialis. Many people are not aware of the variety of benefits that Tadalafil has besides of helping out in the bedroom. And that's because the mechanism by which Tadalafil works is not just specifically for erectile dysfunction. It affects signaling pathways that improve blood vessels throughout the body. So the question becomes, if that's true, what are the broader effects from these phosphodiesterase inhibitors, and how much of what people are saying about Tadalafil is actually supported by evidence? And that's what we're going to go ahead and talk about today. I'm Dr. Michael Moeller. I'm a doctor, but I'm not your doctor. So little disclaimer, anything here said today is not medical advice. You should chat with your own doctor or practitioner before investigating any of these compounds or benefits we'll chat about today. So let's start with that mechanism. Tadalafil, which is the generic name for Cialis, is a phosphodiesterase inhibitor. And what this PDE5 is an enzyme that breaks down something called cyclic GMP. And cyclic GMP is involved in smooth muscle relaxation. So when you inhibit phosphodiesterase 5 in particular, cyclic GMP stays around longer, and this leads to blood vessels basically being more relaxed. They expand, they allow for more blood flow to move around the body. And that's the main idea behind the benefits of Tadalafil. So one thing I think is important to understand is this phosphodiesterase inhibitor isn't only expressed in your erectile tissue. It's found in most vascular smooth muscle throughout the body. So it's also found in your lungs, it's found in your bladder, it's found in your prostate. So from a physiological standpoint, it would actually be surprising if Tadalafil only affected erections. So the question we need to think about is, how does this affect the body outside of sexual function, and how clinically meaningful are those benefits? Now, one thing that we need to think about is that Tadalafil is a longer form of another medication, Viagra, aka sildenafil. And this medication was actually first designed to help with your cardiovascular function. And then they found out, hey, this actually really helps with sexual dysfunction. So we already kind of chatted about this is what helps open up our blood vessel lining. And this is an area that most of the research has been done on. The endothelial lining is the inner lining of your blood vessels, and it's involved in your vascular tone, like how tight your blood vessels are they able to expand, nitric oxide signaling, which helps with the expansion, inflammation, and overall clotting. So several studies have looked at measures such as flow-mediated dilation. In certain populations, Tadalafil appears to improve a lot of those measurements. Now, I don't think this means we can say that Tadalafil reverses vascular disease. I don't think that we can say it makes your blood vessels younger, but I do think that it's fair to say that the evidence that the endothelial responsiveness improves in a vast majority of people. And that's one of the reasons that the cardiovascular researchers have become so interested in this drug class. One of the studies that got a lot of attention recently looked at a very large number of men who were taking Tadalafil. Researchers found overall just lower chances of death, lower cause mortality, lower rates of heart attack, stroke, venous thrombosis, lower rates of dementia. Now, before people hear that and conclude that Tadalafil prevents all of those things, that's not exactly what the study is showing. This was observational data, so the question isn't, did Tadalafil cause those outcomes? The question is, why are we seeing those associations? So those are different questions. So could Tadalafil be contributing? Possibly. Could there be differences between Tadalafil users and non-users that explain the part of the finding? Absolutely. You know, that's one thing where it's like maybe a man who is more willing to go to the doctor and talk about erectile dysfunction may be more inclined to be healthy, right? These are things that is hard when we're looking at the research. Correlation does not always mean causation. So it's a major limitation in observational research. And at the same time, I think it's an interesting signal, especially when you combine it with what we already know about the endothelial dysfunction and or how vascular biology works. So at a minimum, it's one of the reasons that the phosphodiesterase inhibitors are being studied far beyond just erectile dysfunction. And another area that is very interesting is going to be metabolic health. This is particularly relevant for us because many of the men that I work with are dealing with a combination of low testosterone, insulin resistance, obesity, sleep apnea, just overall elevated cardiovascular risk, which that's every man out there. Cardiovascular issues are one of the main things that as men age, they should be constantly watching out for. So, and, a lot of those conditions are involved in vascular dysfunction to some degree. So researchers had looked at things like insulin sensitivity, endothelial signaling, insulin, vascular stiffness, inflammatory markers. And some of the findings right now are promising, but again, it's hard because it's correlation equal causation. I don't think that tadalafil should be viewed as like metabolic therapy. I don't think it should substitute things like improving body comp, nutrition, sleep, exercise, living a healthy metabolic life. But what I would say is that there's enough interesting physiology here that early data, I think, justifies continued research. And in my clinical practice, we do use tadalafil because I think it, we'll chat more about all the different benefits that are at least proposed. And then you just got to, weigh the risk versus the benefits. Now, a major area that a lot of guys here will be interested in is going to be tadalafil's effect on estradiol levels. There are a few studies. Now, many of you know I like estradiol. That's E2, estrogen. We need estrogen for our bones. We need it for our heart, cholesterol, nitric oxide. It's super beneficial. And for guys who are metabolically unhealthy, they have more adipose tissue. They have a higher rate of aromatization, meaning testosterone converting into estrogen. And when there's not a good balance, and that can be different, that can be 10 to 1, 20 to 1, and technically it's 100 to 1 because if you do milligrams per deciliter, and testosterone is usually measured in milligrams per deciliter, where estrogen can also be picograms per milliliter. So it just depends, small nuance. But really, that depends, and that's why it needs to be paired not only when you're investigating estrogen, needs to be paired with symptoms and labs. And that's why if you have multiple years, hopefully, of watching these things, you can tell if it's estrogen causing these symptoms, the estrogen to testosterone ratio. But many of you know I don't like using aromatase inhibitors. I don't like blocking estrogen. But for men who are very metabolically unhealthy with lots of adipose, it is possible that testosterone estrogen ratio gets thrown off. And what's interesting, though, is that we do see in tadalafil, there's some evidence showing that it can help lower estradiol levels or use for, estrogen management. Now, again, it's not going to be something like an AI that comes in and just smashes your estrogen down, that's why I would prefer if a guy's, really in his head. And, half the guys come to me, they heard, high estrogen bad somewhere else. So I have to kind of help walk them through why I don't think that's a thing. But this is promising, and it's another area that I think can help with estrogen modulation. And we also have the issue of xenoestrogens in the environment, right? That's one thing where a lot of people go, oh, estrogen levels, et cetera, et cetera. It's like, yeah, but one thing that estradiol blood test doesn't tell you is how many xenoestrogens, like BPA from plastic water bottles, that are hitting that estrogen receptor and having estrogenic effects in your body. So super nuanced area, but what I'm highlighting on is that there is some research showing that tadalafil may be able to help with estradiol management. Also in that category, there does seem to be also some emerging evidence that tadalafil may either increase your androgen receptor sensitivity, something like making your testosterone more potent, right? The receptor, when testosterone binds to it, making it like if it's normally, let's just say to make things easy, one testosterone hits one receptor, you get 1 pound of muscle. Maybe it would help you produce 1.5 pounds of muscle. Now, that's just an easy example for math. That's not actually how it works. But what I'm trying to show you is your testosterone could technically be more potent. And, that's something that they try and do with the SARMs, which I don't like SARMs, right? Selective androgen receptor modulators. And on the other end, what they're trying to differentiate in the research, is it A, increasing the sensitivity of the receptor, or B, is it actually increasing the density, meaning there's actually more receptors, so more testosterone hitting the receptor. Basically, there does seem to be some benefit to optimizing testosterone optimization using Tadalafil. Now, again, the evidence is still emerging, but again, it's an area that I think is worth considering. So we said, hey, it's going to be helping your cardiovascular system. It's going to be helping estradiol management. Now it's going to be helping, your testosterone, basically how well your body responds to your own testosterone. And then also the next one, it's actually FDA approved for benign prostate hyperplasia, right? BPH, this is where the prostate continues to grow. And the stat is something like half the guys by 60, 90% of guys by 80 are going to have some form of prostate issue. And this is a major problem for a lot of guys because it really disrupts their sleep. So as you're getting older, if you're having to wake up 2 to 3 times a night to urinate, that in itself is going to go ahead and plummet your testosterone levels and overall your insulin sensitivity and overall your metabolic health, right? Like you really need to sleep. And so if you're being woken up a lot from BPH symptoms, Tadalafil may be something that you should chat with your doctor about because there is plenty of benefits. And anecdotally, guys in the comments will probably tell us, hey, yeah, I got on Tadalafil and my nighttime urination, went away. So that's definitely a win. So overall, I hope that you got through this video and you thought, wow, hey, Tadalafil, it's not, hey, my doctor's wanting to put me on Tadalafil for erectile dysfunction. And, the other thing that it's not fun to talk about. A lot of guys can get nervous about it. A lot of guys are embarrassed about it. And unfortunately, it's just a fact of life, especially as guys age. We do, we have the sympathetic nervous system response. Right? You've heard my joke. If you're walking in the woods, you see a bear, not a great time to get into action. It's time to run. And that's because your sympathetic nervous system is kicking in and stopping you from being in a state of being able to perform sexually. So we have the nervous system part, but then we also have the blood flow part. And that's where Tadalafil comes in. It really helps with vasodilating, open up the blood vessels so you get more blood into your sexual tissues. And again, what we're looked at here, it's like, no, it actually gets blood pretty much all over the body. So there are a ton of benefits that Tadalafil is probably going to show us in the research as time goes on. I'm hoping we have more and more papers and more anecdotal, like I have seen it in my clinical practice, work wonders for guys, especially outside of the area of sexual function, just overall, better pumps in the gym, better energy, better mental clarity, nighttime urination. So, I think it's fair to say that Tadalafil it's a much broader medication than most people realize. And that's why it continues to attract attention from, researchers, cardiologists, urologists, physicians in the men's health field, like myself. And I hope you walked away with a little bit more on this compound. Now, if you enjoyed this video or videos like it, please stick around, hit the subscribe button. And I always read the comments. So please give me some feedback from the video in the comments below. And I also have a school community that you may be interested in learning about how I think about most of these compounds. Until next time, stay vigilant, my friends, and God bless.